occupational therapist from Berlin, and I've been invited by Cordoba Institute of Healthcare to support the healthcare course for nursing assistants. And I've been about the rehabilitation part. We have had a very nice time for about 4 weeks. And now today I like to show you a very helpful position for patients who have shortness of breath, of maybe COPD, chronic obstructive lung disease, or maybe about asthma, and also pre-senile patients in their last phase of their life. They sometimes have problems with their atom center in the brain and have problems with breathing. And it can become very worse, and all these patients with shortness of breathing very often get panic, because it's really, breathing is a part of surviving, and when they try to breathe and they cannot, they become panic. Particularly those patients who are immobile, who are lying in bed. For them it's very happy to have this attack of shortness of breathness. And now I try to explain to you a very helpful position. You also can train the families or friends of the patient to support the patient when he has this problem. My patient, I'm very thankful that he supports me today. We together, we show it to you now. And what I like to mention is that, of course, when you have this attack, panic attacks because of breath, it's very important that you inform the doctor, and maybe the doctor also can help with some medical treatment. So you have to inform the whole caregiver team, the doctor, the nurses, and you have to train the family. Okay, first of all, you have to put the patient in a very stable up position. It's very good when when he's sitting absolutely in this position, because that is widening his intermuscular. Yeah, now we are going on with this position, breath releasing position, to minimize or to avoid panic attacks of the patient. Very important is like Fokan, our patient for today, like he is sitting very up, his back has to be very up. I have also put a roll here, because normally patients, when you bring them up in their bed, they slide down right away. And so I rolled a towel and put it here very stable, and so he has more basis and more stability. When I brought him up, of course, bilateral, I touched him, tried to cool him down, and then I put his arm in front of him. I've prepared everything here, my pillows, my sheets, and my towels. You can use everything what you find in the household, as well a blanket or a big towel. It's good when you have this big one, because you need some height. This height better more. So this is not high enough, so I use another thick towel, everything what you find, or a blanket, another blanket, to put it more up. My goal is to bring the arms here forward to widen the whole intercostal area, and to stimulate, by widening it, stimulate the breathing. So, and bring his arm good forward. Again, I try to relax him a little bit, give him some security. Yeah. So I use everything that I find in the household. I use pillows, I can use big towels, I can use blankets, whatever I find. And to stabilize this neck, I can also roll or fold a soft towel or a small roll or whatever. Then he can relax his head. Again, I give him some input, some hands-on. Hands-on is also relaxing a patient very deeply. We underestimate it very often. We think, yes, it's handing on, it's nothing. For a patient who is always in the bed, has problems with his lungs, has problems with his breathing, for him it's also really a big, huge tribute to put his hands on. It's good to work bilateral, not only on one side. By bilateral, it's always more perceptual information for him. So now I've prepared him in a good breath-releasing position. His arms are here, his lung is now wide, and I prepared a line with a tissue. You can also use a balloon. And now I ask my patient, when he's breathing, to exhale his breath. Please exhale and look after this tissue, please. Great. And inhale, very deep and deep exhale. Super. That you let him do until the panic goes down a little bit, and the panic in the most cases really goes down because now the patient sees his breath, and that is supporting him. And then you see, I can breathe. When it's too far, you can close it. I can breathe. I can survive. I'm not going to die right now because of shortness of breath. Please exhale. Yeah. That's all. Thank you very much, and thank you very much to our nice patient, Forkan. I am very thank you for the voluntary who supported our project.